Hi, my name is Dr. William O'Connor. I'm a medical doctor. I'm located in Vacaville, California. And what I'd like to discuss in this video is the problem which is called kyphosis. Kyphosis is a bending forward of the spine. A lot of old people are suffering from it. A lot of young people even suffer from it. I've written a book called Making Your Bad Back Better and produced a website, which is also named Making Your Bad Back Better, that teaches people how to, in essence, become their own chiropractors by identifying whether they have displaced a piece of disc material in their spine and teach them through these instructional videos to put that piece back centrally, recentralize it, and restore their range of motion and take them out of pain. Kyphosis is what occurs if this isn't done. If you do not catch this problem, if you don't catch the back pain problem early enough, you can develop kyphosis. Now there's a difference, a reason why there are some people walking around like this and looking up like this when they're older, and then those that walk like this or stand like this when they're 65 years old like myself, actually 64. But there's a reason why I do not have kyphosis, but I have a bad back problem. I've had one for years. However, I've been able to use my own technique and not suffer from pain or the lost range of motion. Now, the range of motion in scoliosis, or I take that back, kyphosis, is caused when an injury in the thorax or the lower cervical region, such as a fall or a whiplash or some weight-bearing flexion trauma, causes the disc to be compressed and pushed to the posterior, and it locks up, making the disc unable to allow a person to extend fully. If you can't extend fully, gravity starts to suck you down, and you never get over your center of gravity over the spine, and so over time you start bending forward and gravity pulls the spine closer to the ground. If you can imagine what would happen if a wedge were placed, say, at the top of the thoracic spine, and it were to bend the disc forward and make it unable to bend back, how over time that disc would bend that back forward like this, and you would get the classic kyphosis. If you can never extend and those discs are popped out and they act like a wedge towards the posterior, and you can never go back and fully straighten your spine out like this, then you're committed to bending over, and the weight of your head and the neck will eventually suck you over, and you'll be one of those people who bend like this and walk like this. I've seen countless people who I wished they'd have read my materials or got my information and put their discs in so that they could again extend and bend backwards and get their center of gravity over their spine and not go through that deforming process. It's a very common problem. It can be managed. It's a mechanical problem with a mechanical solution. I encourage you to go to my website, www.backachemd.com or backpainoconnor.com. Look at the materials. If you have back pain and you can't straighten your back up, there's tests to show you how you can convince yourself that yes, indeed, there is a mechanical obstruction that is keeping you from bending backwards fully. If you have that, I encourage you to do something soon before it gets too late and the bones remodel. And if the bones remodel in the bent forward state, you'll never be able to straighten them out again. So I would strongly recommend looking into that website. If necessary, you can come and see me in a private consultation, and that's how I help people. Thank you.